Boom. Wow. What?
So the effects of the study and the protocol was really surprising for me in terms of very good effects. Because for me, before the study, radiofrequency was a very good modality, but when I compared papers about lasers, CO2 lasers or HIFO, I was not very convinced. But after this study, I am convinced that radiofrequency has a powerful effect on vaginal well-being and, of course, improvement of the quality of the skin.
Boom. Wow. What?
The perfect patient for the protocol is a patient with two problems. With aesthetic problem, vulva with wrinkles, with floppy vulva, saggy vulva, and problems in the vagino-urinary region. I mean problems with dry vagina, with laxed vagina, the problems with middle level stress urinary incontinence and overactive bladder. Generally, if I could generalize, the perfect patient is the patient who assess her vaginal well-being as medium or bad. The timetable of the protocol consists of 4 appointments with the doctor every 3 to 5 days. On the first day, we perform radiofrequency and we inject filler, I mean hyaluronic acid intense rose. Between appointments, the patient is advised to use gel rose as to hydrate better the skin and for better regeneration between the section. We must remember that the heating can create a state of inflammation, and this inflammation has a powerful good effect, but to improve this effect, to enhance this effect, we use gel rose so as the final effect be much better.
Boom. Wow. What?
The aim of the study was to assess the synergic effect of radiofrequency together with hyaluronic acid. As we know, radiofrequency has a powerful effect of the rise of the concentration collagen and elastin in the skin. From the other hand, hyaluronic acid has a very powerful volumetric effect as well as regenerative effect by enhancing fibroblasts to produce collagen and elastin. We can say that these two players, hyaluronic acid and radiofrequency, play in one team and they has one goal: to improve the quality of skin and to improve the quality of so-called well-being, by the effect exerted on the cellular level. During the study, we want to assess 2 aspects, macro and micro. The micro aspect was assessing the specimen taken from the skin and from the vaginal wall before and after of action of hyaluronic acid and radiofrequency, and macro effect was to assess the patient's impression, feelings and changing of appearance after the coupled action of these 2 modalities. As a tool for the patient, we used Global Aesthetic Improvement Scale, and I must say that in the final assessment by the patient, most of them scored 8 to 10.
Boom. Wow. What?
The interest in plastic aesthetic gynecology and the trend of improving this intimate region is growing. It's been growing for over 7 years. I see in my practice more and more patients of any age with problems with vaginal atrophy, with problems with vaginal laxity, with hypertrophic labia majora, labia majora, and so on. And 7-10 years ago, we didn't have tools for improving the problem, but now, having radiofrequency, hyaluronic acid, fat transfers, CO2 laser, and so on, we can affect this region in a very positive way, and we can make the life of the woman more attractive, and we can make their well-being really, really good.
Boom. Wow. What?
The protocol of associated procedure, hyaluronic acid together with radiofrequency, enable the doctor not to think over how many times, how long the procedure should last. The protocol is the tool, and after performing the protocol, the doctors or over the world can expect the same very good results. Another important aspect of the protocol is that when we compare radiofrequency together with hyaluronic acid, is rather easy to perform. There is no risk to mess up this protocol, these two procedures. Another important aspect is that when we compare to, for example, laser CO2 or to HIFU, is relatively cheap. The RF devices are much cheaper than CO2 lasers or HIFU devices.
Boom. Wow. What?
The features of a perfect filler, the first for me is safety. And safety derives from biocompatibility. The second is resistant to biodegradation, which is normal, and a special construction of, for example, Novia Intense Rose enable it, when we compare with other fillers, to last longer in the tissue. The third is the low risk of formation granuloma. Other are flexibility and the low risk of overcorrection.